Hey, it's Dr. Silva, and I just want to say a few brief words about the nature of anxiety, the nature of endogenous anxiety. Endogenous meaning innate, biological. Persons that, for example, suffer from generalized anxiety disorder or obsessive compulsive disorder or panic disorder or social anxiety, those syndromes that are genetic. They have innate anxiety. The anxiety comes from a disturbance in their central nervous system. And it's poorly understood, and these are syndromes that we're talking about, so there's probably more than one illness. They are largely genetic, but we don't understand exactly what the aberration is or exactly what's wrong, and it may be different in different cases. So not everybody with generalized anxiety disorder may have the same pathophysiology, the same reason, even if they both have a genetic cause. At the end of the day, we're looking at the syndrome, we're looking at the symptoms, and we're treating those symptoms. And the nature of that anxiety by definition is a symptom. It's not just worry. It's not rational worry that's not excessive and that's logical. Anxiety is, by its nature, irrational and excessive. And it is relentless. A person who was a nervous kid, who always has a tendency to worry, who has a tendency to future trip, and to say, what if, or to dwell on the past in an unpleasant way, and the regrets, and I shoulda, coulda, woulda. That person who is not present in the moment, who's always either in the past or in the future, is not attending to really what's going on, who is consumed by worry, always imagining the worst case scenario. That person with generalized anxiety, who's prone to panic, who has a little OCD or a lot of OCD, who's painfully shy in certain situations, any or all of the above, that individual's anxiety is not like the worries that other people feel in certain contexts when they have problems and they are worried about something and they're thinking about something in the future, but it's not a daily thing, and it's only when the problem presents itself. It may be a lot of worry. Sometimes something happens and people really get worked up about it, and you could say that they're having anxiety because it's so intense and it's excessive. It may not be totally irrational. But the anxiety that a person with generalized anxiety disorder has is irrational because it is the emotion. The emotion comes first. They're not really worried about what is external. And of course they are worried about those things. I explain it to patients all the time because they're going to find something in the environment to worry about. Well, I'm worried about this. Well, I'm worried about that. Well, I feel this way because. And they ascribe causality to the stressors. And there are stressors, and they are triggers. They certainly trigger a person's anxiety. But when a person has OCD, it's really bad. That person is going to worry and is going to perseverate because they have a chemical problem, and that's how that chemical problem manifests as a symptom. And so they have this symptom of worry, of dread, of tension, of the need to perseverate on the problem. And so they're going to find the stressors in their environment and the problems in their environment, and they're going to say, I am worried about this, and I feel this way because of this, when that's not the case. They feel the way they feel because they don't have enough serotonin in a certain area of their brain, for example, and that thing in the environment that they're pointing to is not causing their feeling. It may be triggering their feeling, it may be exacerbating their feeling a little bit, but really that's just the rationalization that the mind points to, that it's just the most obvious stressor they're going to grab a hold of, but the worry itself is excessive, so that the problem is really not the external thing. The problem is that they can't stop obsessing about it. The problem is that it threatens to overwhelm them. The problem, the symptom, is what they're feeling, and that feeling comes first. And if it weren't that most obvious stressor in the environment, it would be some other stressor. And that becomes evident when there really are no problems to grab a hold of and to obsess about and to panic over. And so then the mind turns to the possibility of hazards, the impending doom. What if? Well, what if this happens? Well, what if that happens? So now it's more obvious, if you take a step back and look at it, that what the problem is that this person is anxious, and they're feeling anxious, and so they have to find something to worry about because they have this feeling and they have to do something with this feeling. What are they going to do with this feeling? How are they going to grapple with it? And the way that that manifests is that they worry about something, because worrying about something gives them the illusion of control. They're doing something about their problem, right? But they're really not doing anything at all. They're just suffering. They're making their problem 1,000 times worse, because now there's the problem that needs to be addressed, but also the feeling that's tearing them apart because they need medicine, because they need to be treated for a medical condition. And all of this worrying is just symptomatic of that feeling, but it doesn't cause the feeling. The problems, the stressors are not causing the feeling. The causality is going the other way in individuals with this syndrome. And those problems, the anxiety is just masquerading as those problems. If those problems weren't there, well, no, if those problems weren't there, then the person would be inventing problems. They would be, well, what if this happens? Well, what if that happens? Well, what if tomorrow? What if this? And if they're not inclined towards anticipatory anxiety, then they will dwell on the past. They may not have any pressing problems right now, but remember that time when this happened, when that happened, when they were so embarrassed, and the regrets and the failures of the past. They don't live in the present moment. And so I do a lot of debriefing of patients, and I tell them that's not why you feel the way you feel. That's just the form it's taking. That's just the thing in the external environment that the mind is grabbing onto so that it can express this feeling. It's just how the mind works. You have this feeling, and it's the same reason why people will have spontaneous panic attacks. They'll have panic attacks. When I ask them what triggered the panic attack, they tell me they don't know. Nothing. That they weren't even worried about anything. Just suddenly their breathing became shallow. Suddenly they had this feeling in their chest. They thought they were going to have a heart attack, but they know they're not going to have a heart attack because they've been to the emergency room so many times and they've been diagnosed, and they know it's their panic disorder. But there's nothing that, because for some people, when the feeling comes on so quickly, they don't have time to rationalize it. They don't have time to find some reason for why suddenly their fight or flight system, the sympathetic nervous system, suddenly goes haywire. And it's as though someone lit a match. It's a lot like autoimmune conditions in that it's a system in the body that evolution formed for a good purpose, for a reason, to promote survival, that has gone awry. It has gone haywire. It is evolutionarily significant, and it is actually probably a good idea sometimes to be concerned about the external environment and to plan ahead and to have those feelings and those thoughts and those impulses. But when they're happening just automatically for no reason at all, and they're so strong that your heart is pounding in your chest and you can't catch a breath, that is not the way that system is supposed to work. That is a medical condition, and it needs to be treated with medication. It's very similar to cancer, where the cells are dividing and they're not stopping. They've lost contact inhibition. Something is wrong with the programming, and that normal biological process is now a threat. It is a threat to the body, and it wants to spread. And anxiety is very devious. Anxiety, just like cancer, will hide, and it doesn't want to be diagnosed. It masquerades as other things. And a lot of times I've tried to diagnose anxiety in a patient, and they don't want it to be anxiety. The diagnosis provokes anxiety, and they don't. Could it be this? Could it be that? Could it be something else? They don't want. It's like the anxiety doesn't want to be diagnosed, and then when it is diagnosed, it doesn't want to be treated. Anxiety sabotages treatment all the time. Patients don't want to take the medicine. They have all these concerns about the medicine. And if they do take the medicine very reluctantly, they don't want to increase the dose. And, oh, no, don't increase the dose. I've had patients come back and, okay, it's time to increase the dose. Oh, no, how many milligrams? And they ask me, how many milligrams? And they don't even know the potency of the medicine. It's totally irrational. Their question, well, how many milligrams do you want to give me? And If I tell them 50 or 100, but they don't know how potent the medicine is. In other words, they don't know what the normal starting dose is. Some medications you start at 5 milligrams. Some medications you start at 100 milligrams. Some medications you go up to 1,000 milligrams. Other medications you don't go beyond 20. And so if you're not familiar with the dosing, then it's really meaningless for me to tell you, 50 milligrams, 1,000 milligrams, 500. I could give you any number. It's meaningless. And yet they ask the question ready to wrap their anxiety around the answer and be scared at the number that you're going to give them. It is completely irrational. And it's because they're anxious and they're asking the question. They think they're asking the question in an attempt to be mollified, because if they know what the dosage is, then maybe they can be prepared and be careful with it. But really, all they're preparing for in asking that irrational question is to then freak out some more about the answer, because that's what they're doing. They're freaking out, to use medicalese. And it's really fascinating, but I can give you many, many examples that are just like that, where what's coming first, what is primordial, is the anxiety. Everything else is second. Everything else is just a rationalization, intellectualization, all the defense mechanisms, and the patient just trying to grapple with how they're feeling. And at the end of the day, you could educate a patient about all this. They can understand it, completely accept it, know that what you're saying is 100% true. It doesn't change a thing in terms of the feeling. It may help them a little bit redirect their minds so that they don't catastrophize, or so that they don't get too bogged down in external things, especially the things that can't change. And also it may help them to stay in the present moment so that they're not constantly in the future or in the past, not in anything that's real. The only thing that exists is the present moment. But medicine is the answer. It's what's needed, and it can then make possible a person redirecting their mind a little bit when they need to do that. Hopefully it will obviate the need for redirection, because they're not having those intrusive thoughts and they're not obsessing and they don't have those compulsions, and so they are just automatically not doing those things. That it's like automatically not biting your nails anymore. It's just, you're just not doing it. Rather than having to tell yourself, stop. Don't worry. Oh, I gotta stop worrying. Don't worry. Well, when you tell yourself not to worry for hours, you're worrying. It's not working. It's just the worry has taken a different form. And so medication is needed, and then the mind calms down a little bit, usually just a little bit. OCD doesn't go away completely. You still are going to be sort of a cautious person, or maybe a little shy, or whatever the case may be, but it's not consuming. And that's what I want to say about endogenous anxiety. It is endogenous. It is innate. It comes first, and then the thoughts and the rationalizations and the external triggers and the things we hang our anxiety on and say, this is what's causing my anxiety, but it's not. This is what my anxiety is focused on in this moment. I have another video on the primordiality of mood that I'm going to release here in a few days, so I encourage you to check that out as well. Thank you for listening.